Hello, welcome to the Better Wounds podcast. We'll be diving into some of the sometimes complicated healing journey after plastic surgery. I'm your host, Heather Flexer, a dedicated wound care specialist with a passion for guiding individuals through the intricate process of healing. So, today on episode 2, we're going to talk about how wounds heal and what you may be experiencing if you are just healing after plastic surgery and what you can do about it. It's just a good idea to know what to expect. So hopefully you are finding this page if this is for you or you're ready for it. But after your procedure, you are going to be stitched up and closed when you leave, right? That's ideal. You may have drains in place, and that's really just going to depend on the procedure that you have and your doctor. Every doctor does something a little bit different. That's just how it is. But those drains are meant to collect fluid and allow the body to get rid of those collections instead of it sitting in your body. So you have some that use it, and you have some, like the drainless tummy tuck is becoming more popular nowadays. So regardless of the procedure and if you have drains or not, your body has undergone a lot of trauma to the tissue, and you can expect to be bruised, swollen, and because of that, you're going to have more pain. You're going to have a little bit of lack of mobility because of that swelling. The fluid basically fills in between the cells. So they call it interstitial fluid. And that just means that, you've got cells that are sitting next to each other and there's space and fluid fills the space. So that's what's going on. For a lot of procedures, they're using fluid when they're introducing fluid to the body during the procedure, whether it's liposuction or whether they're, rinsing out after a procedure to make sure everything's clean. So there's new fluid that's in your body that's going to create some issues, and obviously it's going to pass. Even if you don't have drains from your incisions, you may have some leaking fluid. Even if it's not open, you may still leak out of the incision line without any actual open holes. That is all pretty normal. So you can expect those things right after surgery. And usually the first few days are going to be kind of the worst, where you are expecting to have the most pain, the most leaking, the most difficulty getting around. So kind of getting your mind around that is a big part of getting ready for this. So you may or may not notice those issues, but within those first couple of days, your anxiety and your emotions may kind of get the better of you, and that's totally fine, totally normal, just something to be aware of and to be expected. It is a traumatic experience, and we all respond to those differently, and it can bring up some issues maybe you thought you were over. So during this time, it's super important that you get lots of rest, but you have to pair that with moving. So the way that your body functions, you're supposed to move. Usually they'll tell you just to take it easy, but they don't want you just laying in bed. They do want you to get up, you got to walk over to the bathroom, you got to walk over to the kitchen. They want you moving in your space. So we want you to be up and moving, usually once an hour. They want you doing something. That's going to help with the pain. It's going to help with swelling. This is something that we tell, everybody to do, even after huge orthopedic procedures like hip and knee replacements. We're having them get up and walk down the hallway right after their surgery. So don't be afraid to move a little bit. It tends to be if you're having more of the mommy makeover and having some muscle repair, it may be a little bit tougher for you. Getting in and out of the bed is always a tough situation. So try leaning, like prop yourself up with pillows. Use what we call log rolling. So you're not going to try to just sit straight up because those muscles were damaged. And we don't want to put too much tension on your incisions. So try rolling over in bed. Use your legs, use your feet, use your arms, but don't try to just sit straight up and use your abs. That's probably not going to go over well. So I've definitely seen people that have overdone it over surgery that causes too much tension on your incision. So you want to be mindful, take it easy, allow your body to heal, especially during these first few days after surgery. So the other super important thing is you've got to be drinking and you've got to be eating. You cannot heal from procedures if you're not taking in any nutrients. So hydration is very important because that is what is going to help to stimulate your lymphatic system, keep the lymph flowing. So that's another reason that we talk about, you'll hear a lot of talk about drinking water, making sure you're getting enough water because that's helping to flush the toxins out of the body. You're probably on medications you're not normally on, like antibiotics and pain medicine and all that kind of stuff. We got to flush that stuff out. If they're incorporating adding fluid into the body, we want to flush that out. That's going to help with getting even the bruising better and just making sure that you are getting those toxins out of your body. Your lymph fluid is thicker than water or blood, and so it actually functions better. Even though you're swollen, you may have this feeling that, oh, I'm swollen, so I shouldn't drink any water. It's actually the opposite. You need to stay as hydrated as possible. You want your urine to be more on the clear side, and that's going to help make your body function at the best possible rate that it possibly can. So get in your fluid, even if you've just got to get out of bed and go drink a bunch, and then you've got to get up because you got to pee. That's good. Moving a little bit is good. And then if you have large open areas, most of our healing, nutrients, what we need to grow and heal our skin, a lot of it is coming from protein. So that's another reason why we're talking about getting enough protein. I'll definitely have a nutritionist on here talking about all that stuff, but you'll see many folks in the community also taking some kind of supplementation. So it's important, like your appetite might be low right now, but you've got to take in something. So look for high quality ingredients. Real food is great. You're probably going to enjoy that more than packaged stuff. So if you can, do as much real stuff as possible. But you'll notice probably within those first 2 weeks, the issues that you may experience are some, and we'll talk about this, are spitting stitches, too much tension, and some pulling on the incision, more drainage, stuff like that. So during this time, it's super important to do what we were talking about, moving a little bit, resting a little bit, and keeping an eye on things. So you've got to watch out, especially within the first few weeks, of signs and symptoms of infection. So if you were to have an infection that happened like during the surgical procedure, that's probably going to come up around the first 2 weeks. So that's like when you're most at risk for those things. So you're looking for those typical signs and symptoms of infection. So is it red? Are you noticing redness that's spreading? So it's not just staying right along the line, but it's spreading. Those are signs of infection. If all of a sudden you start draining a lot more, that's a sign. If you just in general feel like crap, or you feel like flu-like, and you haven't been exposed, obviously, to anyone who is sick, those are signs of infection, and you'd absolutely want to get in touch with your doctor, your primary care physician, urgent care, whoever you're using. If you have signs of infection, that is like a sign to get into action and make sure that you get medication. The risk is that you could go septic. You could, if you're talking about areas like breast implants or something like that, I've seen people need to have their implants removed because of an infection, because the implant gets removed or gets affected by the infection, the bacteria. So this is not like anything to mess around with. It doesn't like just go away. You need to get treated. Some people will continue to wash their body with Hib cleanse, I assume, because they're worried about infection. The problem with Hib cleanse and using antiseptic wound washes and things like that when there aren't signs of infection is that you're killing all the good bacteria as well. And you're also creating what they call a cytotoxic environment. So you're killing all the bacteria and you're making it a very like dry area, and that's going to be not great. So if you don't have any signs of symptoms of infection, you don't need to use Hib cleanse for a body wash. You don't need to use an antiseptic wound wash on your closed incision. That's kind of like overdoing it. A lot of people do just fine with like the generic dial soap. You can use that. And you want to make sure you also are allowing the incision area to dry once you've been cleared to take a shower before you put on any garments or anything. The other thing that you want to make sure that you do is like your skin's dry, whatever bandages you're putting on, you don't want, fungus or bacteria to grow in that area. So make sure you're dry. You also want to make sure that your skin is hydrated. A lot of people will complain about itchy, dry, flaky skin. If you're talking about like you're wearing your garments, those compression garments have a thickness to them. They are kind of abrasive on the skin. Your skin is like so fragile. It's okay to use like a moisturizing oil or something. Just kind of stay away from the incision, but you could do the rest of your body. Wearing your compression is really important. That's going to help to provide some counter pressure so that your body just can't like swell out and take up as much space as possible. You're wearing the compression because your lymphatic system is an open system and it needs the outer compression. So wearing the compression helps to limit the amount of swelling, but inside the garment you're like rubbing and there's some friction happening. So you have to like, it's a fine battle. A lot of times people will use a few different garments, but another really great thing that you can do is wear like a tighter camisole type thing. Look for one that is like dry wick and has no seams, and that'll help prevent like lines and rubbing, but it'll help protect your good skin and have that not become irritated as well, because that's like the one thing that you don't want to deal with is just irritated skin all around. But wearing your compression is super important. So one of the issues that comes up a lot and I see often is spitting stitches. So even if your doc says that dissolvable sutures were used, sometimes your body just doesn't like them and it doesn't break them down. And it may not be like a problem everywhere. You might just have like one area. It almost kind of, looks like you're getting a pimple or a zit or something like that. Like you'll have a little raised area underneath or like this one spot that keeps leaking. And sometimes there's a hair or something in there if we're down by like the pubic area. But a lot of times it's just a stitch that is working its way out. Sometimes you'll just have like this little thing that's like poking out. And it's okay to trim those, or if the whole thing is there to remove them. Just make sure that you're using sterile tools. So boil your tweezers or tiny scissors or buy brand new ones. Alcohol swab them. Don't just take the ones right out of the medicine cabinet that your whole family uses. because then you'll likely be dealing with signs and symptoms of infection. So obviously we don't want you going digging and trying to find these stitches, but it's okay to trim like the little pieces. You can always work with your doc about that. Your post-op care provider might be willing to help you with that. But I see a lot of times people are pretty comfortable or their family is able. Just make sure you're using clean tools. So do you need to remove the stitches? The problem is if we're talking about wound healing, right? If you have a stitch or a hair or something in the hole, it's a barrier to healing. So ultimately it needs to be removed. And you can kind of think of that not only with a stitch, but also with necrotic tissue. So if you have like a big scab or an actual necrotic wound, all of that needs to be removed in order for the wound to heal. So I know I've talked about this before, but wounds heal basically from the outside in and the outside in and the bottom up. So that's how your like wound will heal. And if you have something in the middle, like if you think about if you were to dig a hole, right, that you were going to plant something in and you were going to try to fill it with sand, right? That would be your wound trying to heal itself. It's trying to fill it in with sand. When you go to fill that hole, the bottom gets filled up first, and then it just kind of like grows across, like the sand just fills in the hole if you keep adding more in. Now, if you were to put like a big rock in the middle of that hole, but you didn't want the rock there, the sand can only fill around the rock. It's basically like a stitch or a plug of necrotic tissue. Your body cannot fill in the hole if that stuff is still there. So that's why we need to have those things removed or the necrotic tissue debrided so that your body can actually go through the healing process. Feel free to post comments or ask questions in the comment section here if you have questions about that, but the wound needs to be cleaned out in order for it to heal. So it's not unlikely that if you don't remove that stitch, that it won't heal. It'll continue to create an issue either until it finally breaks down or it's removed. So now if you have an incision that's splitting open, a lot of times that can be from too much tension. So either you're pulling too much, like standing up too straight too early, or there was too much swelling. And so that's creating an issue there. In this case, if your incision is starting to break down, obviously be in touch with your doc, but you want to continue to wear your compression, just not as super tight. Having the compression is going to help make sure that you're not filling up with more fluid, and then the fluid would just come out of the hole that's there. So you want to wear that compression, just not too tight. You want to use a wound cleanser. Make sure that you're trying to keep it clean, but don't necessarily start using ointments, especially if we're talking about like a tiny little area. If you can keep it clean and you can use an absorbent pad in your garment to soak up any fluid, that's going to, and I would only put ointment like on the very little open spot if it's more on the dry side. But if we start slathering ointments on the incision line while it's kind of fragile, you may wind up creating more areas that open. So I usually, and your doc is probably telling you this too, right? When you have an incision that's mostly closed, to keep it dry. So don't then start adding in all these ointments because you saw that someone said to use it. It really just depends on where you're at in the healing process, and you can kind of make things worse. So keep it clean and keep it dry, even if you have like a tiny little opening. If you have a bigger opening, then that's when we may need to start doing some actual wound care. But the other issue that I see a lot in this early stage is lipoburn. And a true lipoburn is going to be present pretty much immediately right after surgery. The problem is sometimes people are being put in garments at also immediately, and so they are sometimes told it's a faja burn. Now, a lipoburn is going to be much deeper. The burn is happening much deeper, and you're just seeing the damage on the outside. But the faja burn is more of a superficial area. And if you were to remove the faja, that should get better. If it doesn't get better, chances are more likely that if it doesn't get better and it's deeper and the skin looks kind of charred, chances are it's more of a lipoburn. Now, the lipoburn will go through an evolutionary process. They start off dry. That tissue tends to need to be debrided in some fashion. And then we're looking at like a little bit of a deeper issue. So that's when we obviously need to start using wound care treatments. And if that's you and you feel like you're in that kind of situation, feel free to reach out wherever you're finding this, but you can always find me on betterwounds.com. But talk to your doctor, see what they say. But in this case, necrotic tissue needs to be removed, and there's several different ways of doing debridement, but moist wound healing is going to be a better option than keeping it dry at this point. So don't get confused. I'm just putting out information out there. It's much better if you reach out directly and I can kind of guide you as to what it is that you're seeing, especially if you're not like really sure what you're looking at. Don't just guess, but make sure also if you are some tips if you're not seeing any signs of infection, keep that antiseptic cleanser for when you see infection or if you see signs of infection. We want things to be useful for when we need it. So it's like we don't take antibiotics when we're sick, same situation. And a very common treatment that you'll see recommended out there is wet to dry, which is just a moist gauze being placed on an open wound, and then you're supposed to take it off dry. There's lots of reasons why that is not really the best option for you. They tend to create more chronic wounds, and there's much better products out there that can be used for debriding or maintaining a wound or filling in a space. It's common because it's what people are taught. It's the oldest form of wound care. That's why it's common, and it's cheap. It's not always the best, and it may cause like a slower healing wound. Of course, I'm sure I'll get comments that I did it and it worked well for me. Well, that's fantastic, but it may have gone faster if you did something different. But I'm glad you're healed. If you happen to be someone that used wet to dry and healed, that's fantastic. But just know that there's other options for you out there. And if you are not sure what you're doing, if you feel like you're kind of getting the runaround, you can always reach out to a wound center near you and see if they take appointments, how it works. Do you need a referral? Is your insurance gonna cover it? All that good stuff. So there's lots of options for you out there. I often hear from people that they were afraid to contact the wound center, and then when they did, it wasn't that bad. They didn't need a referral. So make some phone calls if you find yourself, especially if you have a large dehisced wound with a lot of necrotic tissue or a pretty significant lipoburn, and your doc is telling you to use wet to dry. I would suggest trying to get in touch with a wound care specialist in your area. But as far as for me, if you are in need of help, if you want to do a virtual appointment, I do personalized video consults. You can reach out to me at betterwounds.com/shop. You will see the first option is going to be a wound consult, and you can grab that if you need a second opinion. If you just want to know, is this me? Do I need help? What's going on? I don't know what to do. I do that kind of appointment all the time, and I at least get you on a path of here's where you are now. Let's get you situated while you wait to get in your appointment. And then you're just in a better position when you do get to your wound center. But feel free to reach out if you need anything. And if you do want to grab a consult, use the code podcast for a discount. And drop a question or a suggestion or recommend a speaker that you really think. Recommend yourself if you want to come on and chat in a 5-star review. Really appreciate it. Thanks for joining me for episode 2.